Reduced blood flow to the uterus can also compromise the development of a healthy placenta during pregnancy. And this increases the risk of pregnancy complications such as placental abruption or even preterm births. So, how do we treat uterine fibroids? Okay, so there are two main things to consider. The first is, has the woman completed her family and therefore wants no more children? Or is this woman who has been diagnosed with uterine fibroids trying to preserve her fertility because she either hasn't had children yet or wants more children? Let's deal with the women who have completed their families really quickly to get onto the juicy part, which is what most of you watching this video are going to want to know. Fibroids, as well as, obviously affecting your fertility, which we have just discussed, they can be very, very debilitating in terms of the symptoms. The most common symptom being heavy vaginal bleeding can be very, very disabling and debilitating for some women, affecting their activity of daily living, such as being able to go to work, being able to care for their families, even being able to do simple things like exercise, because they just bleed through their clothes. Some women, the bleeding is so bad that it causes them to feel lightheaded, and when they lose so much blood, it can be as bad as them feeling short of breath. In these women, once we have tried using intrauterine devices such as the Mirena, or we have tried other methods of treatment in order to preserve the uterus, and all of these other methods of treating uterine fibroids whilst trying to preserve the uterus, if a woman has completed her family, it is out of the scope of this video. But once all of these have been explored and the woman continues to bleed quite heavily, the only option really remaining is to carry out a hysterectomy. And a hysterectomy is simply when the uterus is removed. Now, obviously, for most of you watching this video, this is not an option because you want to have a baby. So remember, when a doctor tells you that you have a fibroid, the next immediate question should be, which type of fibroid do I have, doctor?